Hello everyone, I am Dr. Rushit Shah, medical oncologist from Apollo CBCC Cancer Care Ahmedabad.
Hello friends, this is Dr. Vijay, consultant surgical oncologist from Apollo CBCC Ahmedabad.
So today we are going to discuss about lung cancer. Month of August is a lung cancer awareness month, and as we know that throughout the world lung cancer is one of the most common cancer which is diagnosed day to day, and it is responsible for very high number of mortality or deaths due to cancer. So we take this occasion and we try to share with you some information regarding the lung cancer. So with this background, Vijay, what are the causes or etiology behind the lung cancer?
As you all know, over the entire world, everyone speaks about this, that smoking is detrimental to health, and this is one of the single most factor for causing lung cancers also. Apart from other cancers, smoking is in direct relation to cause lung carcinomas, be it active smoking or passive smoking. So if someone is smoking, it's harmful to them as well as to their family members or with whom he or she is surviving. So one important thing. Second important factor is a previous history of chronic lung diseases. By chronic, I mean long-standing lung problems, which we in medical terminology term them as chronic obstructive pulmonary diseases. These also have a chance of developing lung cancers. And third, environmental exposures, which in relation like arsenic, argon, radon, multiple gas, asbestos is one more important industrial element, which all these things lead to higher risk of getting lung cancers or sometimes even pleural-based malignancies. One more factor is about a family history of lung cancer or a previous history of certain other cancers and radiation to the lung cancers. These are all other factors which may lead someone to fall into a lung cancer situation. So, Rushit, after knowing the risk factors and the causative factors for lung cancers, what are the typical presentations by which usually the patients present to us?
Right. So most of the time, one of the most common symptoms of lung cancer is cough. Cough, when it's long-standing or chronic cough, we do suspect about lung cancer, and typically for the patient who is a chronic smoker. So long-standing cough is one of the most common symptoms, which in Indian scenario can mimic tuberculosis also. So most of the time, or many a times, patients are treated with anti-tubercular drugs, and later on they are found out to have lung cancer. So long-standing cough should not be ignored. Another common symptoms is breathlessness due to the tumor compressing the lung or obstructing the air pipes. So in this way, lung cancer can also cause breathlessness. When the tumor is close to the surface of our chest wall, it can also produce chest pain. In whatever situation where the tumor is located, depending upon that, patient may have chest pain also. Along with the cough, patient may have blood in the sputum, so that is called hemoptysis, and it is one of the common symptoms and specific symptoms of lung cancer. Another common symptom is effusion, pleural effusion, that is fluid in the chest wall. Under the chest wall, between the lung and the chest wall, there is filling up of the increase in the fluid. That is what we call pleural effusion. So in that case also, fluid pushes the lung and patient can have breathlessness. So these are the symptoms pertaining to the lungs or the chest wall which develops due to lung cancer. When it spreads to the other organ, the symptoms can develop according to the site of metastasis or the spread. Those symptoms are when it spreads to the brain, patient may have headache, convulsion or vomiting, nausea, etc. When it spreads to liver, a patient may have decreased appetite or jaundice, and when it spreads to bone, patient may have complaint of bony pain in the back or as well as other sites where it has spread. And so these are the general common symptoms with which patient usually presents to us when they develop CLI. So after knowing the signs and symptoms, Vijay, how do we investigate this kind of patients?
As you have rightly mentioned, Rushit, about all the symptoms depending on the stage at which the patient may present. So once the patient comes in, we'll take a complete clinical history of presentation, the duration since how long he is actually presenting. So there is one important thing here we need to understand whether the patient is presenting with just shortness of breath and cough along with the hemoptysis or not. These are the two factors which we should delineate thinking about where the tumor might have been. So depending on which we can titrate our initial investigation of choice. So but as such, most of the times when patients come to us, they either come with a CT scan report in their hand or a chest X-ray report suggesting that there is some growth or some suspicious lesion in the chest involving the lungs. So the first investigation would always be, if there is a suspicious lesion in the thorax, particularly in the lungs, then the first investigation should be a PET CT scan, by which we can stage the disease. First we know whether the tumor, the suspicious thing which is there in the lung, is a tumor or not. If it is a tumor, what is the extent of it, what is the size of it, how many lobes of the lung are involved, whether there are any lymph nodes are involved in the thorax itself or not, the draining areas of that particular lung. Apart from that, it would also give us a clarity whether the disease, if at all it is a disease, if it is just restricted within the thorax or it has already spread out elsewhere. So why is it important? It is important because it would definitely change the treatment, not just with respect to the treatment later on, but also with respect to the diagnostic part. So once the disease has got spread elsewhere, we need to confirm that the disease has got spread elsewhere. So for that, by doing a PET scan, we would know that, and we would target our biopsy, the tissue diagnosis from that particular area, proving that the disease has already spread to these areas. So PET scan is mandatory if there is a suspicious lesion in the lung. Sometimes it does happen that patients do present only with the bleeding in the like hemoptysis, as you have already mentioned. In those cases, even a PET scan shows only if the tumor is only within the lung or it has not got spread anywhere or just within the bronchus or the windpipe or the branches. In those cases, sometimes we may also have to do a bronchoscopy under guided lavage. We'll just put some fluid in it and aspirate it back, or even a bronchoscopy guided biopsy also. This is one part to confirm the diagnosis that it is malignant lesion within the bronchus, that is a windpipe, or in the lung or not, depending on the biopsy. Second part, additionally, suppose if the disease has not got spread elsewhere, but it is just within the lung, to know what kind of treatment we have to go ahead, whether it is surgery, whether it is chemotherapy or radiation, which we would be discussing in our next episode. So there we need to do certain investigation to see whether the lymph nodal spread has got occurred or not in between the two lungs, which we call it as a mediastinum, which is also done by a bronchoscopic guided FNA, which is nothing but 5-needle aspiration, wherein a small needle will go into the suspicious area, remove that part, we'll see it under the microscope, see whether it is involved with the disease or not. So depending on these things, the treatment versions change. So a clinical history, a PET CT scan, a biopsy, or sometimes which may be direct guided, CT guided, or a bronchoscopy guided FNA or a biopsy. These are the basic investigations which we do when the patient presents to us. But apart from this, when we do a biopsy, a molecular diagnosis is also important in certain scenarios of lung cancers. So Dr. Rushit, I just want you to tell us why is that molecular studies are more important in case of lung cancers?
Yes, so there is very much role of molecular diagnostics in cancer of lung. Mainly after the diagnosis, we would like to confirm that the tumor is primarily originating from the lung. For that, we do an IHC panel or immunohistochemistry on the biopsy block. After confirming that, we may do molecular markers in certain situations like advanced lung cancer most of the time. So we run a certain panel of tests to know that how the cancer is going to behave, like what is the prognosis that is going to be. And second thing is to select the treatment, particularly targeted therapy and immunotherapy, which is very much role in the cancer of lung. So for those patients, we may order that specific molecular markers. That again we are going to discuss in the therapeutic part in the next session. So that is the thing. So So I think we'll conclude here with the investigation, and next time we'll be discussing treatment and the prognosis of lung cancer patients and how is the quality of life with lung cancer. Thank you.
Thank you so much.